I'm going to talk to you, I'm going to tell you what it is that I'm looking at when I assess you for lip fillers. Talk to you briefly a little bit about the anatomy surrounding the lips and why it's important to know where things are and what things are, but I won't go into too much detail because, you know, it's not a science lesson. And then a little bit about filler treatments themselves. So essentially, if you come to me for consultation, obviously we need to go through a proper, hi Michelle, a proper medical consultation. Again, not something I'm going to talk about right now. That's probably a conversation for another time. But obviously, from a medical perspective, I need to know that you are suitable to have a lip treatment, essentially, which is why we go into detail around your medical history and things like that. So when I am looking at you, just what I need to know is what it is you are have an issue with. What are your concerns? What results do you want to achieve from having treatment? And obviously, of course, you know, whether or not you are suitable from a medical standpoint. When I'm looking at you to assess you, I'm looking at the shape of your face. Do you have an oval shaped face? Have you got a heart-shaped face? All of those sorts of things. So I'm looking at your face overall, not just your lips, because your lips are a small proportion of essentially your entire appearance and your face as a whole. So I need to look, you know, at your face from the whole perspective, and I look at that from both front on and also from your profile as well. So which way am I going? So from the side as well. So I'm looking at what do your lips look like and what's the projection and everything from profile and front on. And what we're trained to do when we're assessing people's faces in aesthetics is to break it down. Okay, so we're breaking it down into sections of the face. Okay, usually for, you know, that's 3 sections. So we've got the upper face, and then we've got the middle face, and then your lips fall into the lower third. So we split the face into threes, into thirds, and assess again from that whole standpoint. So what is going on in that, not only in your whole face, but in that third of your face as well. And then we're looking as well at so what is your face looks like, what's happening with your lips from a still point of view, so at rest, how do your lips look at rest, but also then on animation as well. So when you're talking, you know, I'll often get you to you know, purse your lips as if you're blowing a kiss, or say the days of the week, so that we can see what's happening to your lips as they move, because actually that's a hugely important part of assessing lips. There's lots going on as you're talking, and it's not necessarily something that you might notice, but actually when you're talking to other people, it's what they're going to notice. And then we're thinking about obviously the natural shape of your lips. What shape have you got? Where, you know, thinking about your age as well, whether or not aging is a significant impact on how your lips appear at that moment in time. I look as well at anything like asymmetry as well. So actually, I think a lot of us might not realise that there might be you know, one side of your lip might have, you know, a bit more volume than the other, and then, you know, there could be all sorts of factors that have impacted on that. But so we're looking, you know, how symmetrical are they? Do you have any blemishes, any scars, things like that? I mean, I know that I've got like a freckle on my lip, on my top lip, but only on one side. So actually, when I had lip fillers, I think it was just over a year ago, it's something that, you know, becomes more noticeable. And I've had a lady who's got a scar on her lip, and actually having lip fillers made the scar look more noticeable. But actually she quite liked that because that's part of her. So it's important to think about those kind of those kind of things that actually impact how the lips are going to look, again, after anything that might be enhanced after filler. And also whether or not you've had any previous treatment. So not only would I look at your lips from different angles and different perspectives, I would also feel your lips as well. Do you have any already existing lumps and bumps in there that we need to know about? Again, it could be scar tissue. You might have had previous filler before, so we need to know where those lumps are. If there are any, of course there might not be. And just generally, you know, can we feel the fat pads in there, all of that sort of stuff. We also look in terms of projection. So what we don't want, lots of people are like, oh, I don't want a duck pout or big pouty lips that just look too done. So we assess that in terms of essentially what is drawing a line between. So what I would probably do is get a ruler, and there's lots of different ways to assess this. This is the way that I tend to choose, which is called the Ricketts line. I'm a bit backwards on here, so I'm trying to figure out. So what we would do is take a straight line, essentially, so a ruler from your chin to the top of your nose, and figure out at rest how much distance there is between the straight line of the ruler at a side profile without actually talking, and assess that in terms of how much projection could you afford to have in that area, or you know, what would we want to avoid, that sort of thing. Now, generally speaking, obviously thinking like I said about your natural shape and projection, the slope of your lip, your philtrum column, all of that sort of stuff, but also in terms of the ratio between top and bottom lip, and generally speaking in Caucasian ladies, we're looking mostly the bottom lip should be ever so slightly bigger than the top lip. So actually that gives a more natural appearance. It's usually a 1 to 1.6 ratio, which gives it's a more natural lip volume in Caucasian ladies. It is different, so it does depend on ethnicity here when we're looking at volume of lip volume between top and bottom. It does matter based on obviously not only what do you want, but also ethnicity is a big part in that, and it sort of keeps more in keeping with the natural for people of different ethnicities in there. So like I say, so that there's quite a lot going on there involved in assessing what a change to your lip structure or volume or anything like that would look like. So we'd have to think about all of those sorts of things, as well as the medical history, what it is you want, what it is you don't want. And then when I come to think about actually treating the lips, so hi Nicola, what anatomy is involved in the lips. Again, it isn't too much about what necessarily you would know or notice or anything like that, but from my perspective, when I'm thinking about coming at you with needles, I need to know where things are, how things are moving, and what's going to change and impact all of that. So I'm looking at the muscles as well. So I've got my little muscle thing here. So I can't see what I'm doing. This is quite a basic, simple anatomy illustrations here. But we've obviously got this circular muscle that goes all the way around the lip, all the way around the mouth. Sorry, I'm talking too fast here. The orbicularis oris, okay, so that's the muscle surrounding the whole of the mouth. And then we need to think as well about what else is happening in the rest of the face that impacts on the lips. So what is your facial volume like higher up in the face that might have aged, and as we age and we lose bone and we lose muscle size changes, either decreases, some increase, that kind of thing. Then the fat then can drop, and we're looking at the muscles that are surrounding it. So all of the muscles that are lifting up, so the elevator muscles that lift things up, and then the depressor muscles that pull things down. So we're looking at obviously not only the fat in the higher levels of the face and the lips, but also how the muscles are affecting all of that as well. And then this is great, thank you. Good. I shall keep going. I've got a little bit more to go through. So the other thing that I look at or I think about as well is around you know, your arteries, your vessels, and yeah, it's a hugely complex structure of arteries, vessels, veins, all nerves, sorry, all going through through your face. But I'm thinking when I'm treating lips about where I'm looking to treat and how I would do that, and the surrounding vessels that's all going on that I need to worry about in terms of making sure I avoid them. So obviously, again, a much simpler anatomical version, but essentially facial arteries coming up the side of the face and branches out across and around your mouth. So you've got your superior and inferior labial arteries that are essentially running around your lips, and they run up and join into your nose, which is why I mean, these vessels are hugely important for supplying the tissue around the lips and to the lips and further up and in and around the face. And so when we see some of those horror stories, as it were, about filler treatments that have gone wrong, and people have got all sorts of definitely needs a medical practitioner. Yeah, you know, it really should be. There's a lot going on anatomically in the face, and it really needs the practitioner to be very aware of not only what the muscles, the fat, and all the rest of it is going on in the face, and the vessels, where they are and at what level they are. So there's all sorts of different levels to the skin. And you know, we talk about can't understand why anyone would go to a beautician. Well, unfortunately, you know, some people do, but however, you know, it is really important that we know the anatomy of the face. And when we talk about layers of the face, from a medical perspective, we talk about the skin, we talk about the superficial fat, muscle, ligaments, deep fat and bone, and it's all to do across the face. And in fact, when we're talking about lips specifically, we're thinking about all of that, and we're also thinking about teeth, because actually we've got huge amounts of impact based on what our jawline is doing and what our teeth are doing. So actually, that's another thing we need to take into consideration is you know, the projection of your teeth. And so how would lip fillers affect, or how would your teeth affect your lips if they were to be treated with filler, for example? So yeah, I'm just checking my notes now to see if I've remembered to include what I was saying. Let me just see any more practitioners comments. No. Okay, so so moving on then, I think I've talked about the vessels. Yeah. So thinking about filler itself, essentially what is filler? It is it's a viscous gel, essentially. So it comes in all of the fillers that I use are hyaluronic acid based. So basically what that means is hyaluronic acid is a compound, is found naturally in our skin, and it has been synthesized and what they call cross-linked to give it more stability and more longevity, so it's lasting longer, and turn it into a gel form, which means it integrates really well into human tissue. It doesn't last forever, your natural hyaluronic acid in your skin usually has a life cycle of around 3 days, I believe. But with the chemical cross-linking process to make it more stable into a gel form, how long do lip fillers last? Lip fillers can last, depending on the type of lip filler that you have, can last anything on average 6 to 18 months, there or thereabouts. And again, the type of lip filler that you have, also it does also depend on all of the things I've just talked about around your anatomy, how much movement, how much aging impact has had on your mouth and your lips, and about what type of result you are looking for. So some people might have a lot of lines around the lip which essentially means kind of the vermilion border, the very edge of your lips, has aged and is compromised, so you're getting more of those wrinkles, in which case you might want to consider a slightly more firmer filler to really put that support back in place around the mouth. Whereas a younger lady, potentially, or man, but a younger person might actually have really good structure to their lips, but just desire a bit more volume, perhaps, in which case then we would only really need to treat the body of the lip in itself with filler, and you might not need something quite so firm. But actually it's again, when we talk about fillers in general, without getting too scientific, we talk about the elasticity of filler, and that is how, as a practitioner, it guides my decision on which type of filler to use for somebody. So it's not necessarily about it being softer or thinner, but actually what is the elasticity of it, because actually what we want with lips is for that bounce back, and we want to be able for that area of your mouth to move quite freely and bounce back into a healthy, natural kind of position. So those are the sorts of things that are helping to guide me in product selection, which again is why, if somebody comes to me and says, oh, I want this amount of this product, and I say, okay, why? I need to know, are they asking for that because that's what their mate had, and they think that's right? It may not be right for them. So I will ask questions around, I'm quite happy to consider your request in that sense about what you would like and why you would like it, but ultimately the product selection, as it were, I'm thinking about more things that go along with that. What would you do if someone came for lip fillers and insisted on having something which would look awful? I'm going to tell them that. I'm going to say to them, obviously I'm going to listen to what it is that they are asking for. What are they trying to get at? It may just be that they haven't been able to express what their desired result actually is, and so I'm going to try and work with them to figure out what it is that they're going to want and why, because it is really important to know why, and also we need to think as well from again, as part of what I mentioned at the beginning about your medical background, and one of the things that I will look into as part of the medical side of things is around people's motivations behind wanting treatment, and why it is they are looking to have treatment in the first place. Are they doing it freely of their own will? Are they being pressured in any way into wanting treatment? So I'm looking at, or do they have any real strict persistent hang-ups about their appearance that actually might be more of a mental health need over an aesthetic need? or an aesthetic desire, should I say. So I'm looking at that. So again, it could come down to something that actually I know, and I would say to them, look, I'm not going to do that particular treatment that you're asking for, because it would look terrible. And I've got to be honest about it, and I'm only going to provide someone with a treatment that I think is going to give them an aesthetic benefit, something that is going to look good and natural and in keeping with the rest of their whole face and their whole appearance. Because what I'm not here to do is just take your money, inject you with what you're asking for and send you on your way. That's not how I want to work. So yeah, it's a no-go from me. But I will talk to them about any other options that would be more suitable, because it may just be that somebody needs a bit further education around something. So yeah, I'm just checking my notes again to see what else I've missed. I answered the how long do they last question. I did have another question as well that came through on Facebook post. Is it true that it hurts like hell? Well, a couple of things. Before treatment, what we do is we apply a topical, so a cream, a numbing cream, to numb the area around the mouth and the lips. The lips are a particularly sensitive area. They are very fine, they are very thin. I have to think very carefully about where and how deep I'm going to inject your lips and how many times. So we use topical numbing cream. We put that on 10 to 15 minutes before we think about injecting and let that work. Also, the products that we actually use as well are, they contain lidocaine. Okay, so that is an anaesthetic included into the gel filler. So actually, people would often say that we numb the area first. After the first couple of injections or so, that lidocaine is starting to take effect and it's getting in there. So actually that is numbing again. So there's two lots of numbing anaesthetic involved. Yeah, it's not, I have had my lips done. It's bearable. It's not the most comfortable procedure, I'm not going to lie. You know, it's not a walk in the park. But actually you can kind of, I give my ladies, I've got stress balls. So actually if somebody's a little bit uncomfortable or a little bit anxious, I've got fidget cubes or stress balls that people can kind of like grip onto if they're just feeling a little bit and want to take the edge off. And more often than not, people tend to say that actually it's the anxiety and the anticipation of what it's going to feel like, as opposed to what the actual pain of the treatment itself. Hopefully I do everything I can to put you at ease and help that, so that you do feel a bit better. But ultimately, yeah, I mean, it's not completely comfortable, but it is bearable and it is okay. So yeah, so that is a very brief whistle stop tour. Let me just check that I haven't got any more questions that I haven't answered. If you've got any questions, pop them in now and I will get to answering them. Yeah, okay, so I think I've answered everything and I think I've gone through, I may have missed off a few bits in getting distracted, but that is, in a nutshell, very briefly, the sorts of things that I'm looking at when I'm doing assessments. Thank you, you're welcome, Helen. Yeah, when I'm assessing somebody for treatment of filler, the sorts of things I'm looking for, the sorts of things that is also going on probably quite quietly in my mind in terms of all the anatomical information. But rest assured, I am seriously thinking about all of this stuff. Very informative, thank you. Thanks, Michelle. I'm glad you found it useful. So yeah, that's what's going on really for me inside my head. I'm thinking about the anatomy, and I'm thinking about how it's going to look for you after, and all that sort of stuff. So yeah, I might talk to you about the actual results and what you want, but you know, my little brain is ticking away in there. But thank you for joining me. I shall leave it there. If you've got any questions, feel free to drop me a message or give me a call, and I will happily answer them for you. So have a good day. Take care.